Right, so now we're going to get into the nitty-gritty of entering data. But before we do, I want to show you a few little things. First off, these blocks with the green triangles in the corner are calculation blocks. They're actually going to be taking data from other blocks and putting them in here. So you don't have to fill in anything on these little blocks that have got the green triangles in the corner, except for one specific situation. The last audit tool was quite frustrating for people because we have to write in the date and the time. And this is important because if patients stay for longer than 24 hours, we need to be able to calculate how long they're staying. And if we just write in the time, Excel only works up to 24 hours. It will not work beyond that. So if you have a patient who stays for 25 hours, it will report it as 1 rather than 25 that we want. So we do need the dates and then we need the times, but the dates are quite frustrating to have to put in for every single thing. So what we've done is we've made it quite easy. Here I'm going to enter a date, and you'll see immediately what happens as I enter that is it actually propagates across the entire form. For every time there's a date needed, it will actually enter in the date that I put into that first slot. Now, that's all very well if the patient's visit just takes place in the space of a particular day. Obviously, the issue comes in when it crosses over the midnight line. So let's say that this next patient arrived on the 5th of October, but they arrived at 11 o'clock. So let's let them get triaged by 11:30, and let's put the folded note time at the same time. We'll pretend this was happening in parallel. Now let's pretend that actually the patient was seen after midnight by the healthcare professional. So we'll say they were seen at 12:30. What we need to do from here is that we actually need to change the date manually. So I need to put in 6th of October 2012. And you'll see that what happens is from that date on, that new date gets propagated across here. Now, let's say, for example, that the patient actually was seen then, but actually only moved the next night at 1 o'clock in the morning. We would, of course, need to change that to the 7th of October. So anytime the patient's visit crosses over the midnight line and they move into a new date, we need to change that manually. Otherwise, it's all done automatically for you. Right, so this is getting down to the nitty-gritty of how we enter the data so that we can actually get something out of it. And we're just going to go along each column. Some of them speak for themselves, but some of them need a little bit of clarifying. For any of the dates, please note the way that the date is notated. We put in the day in numbers. Just watch up here because it seems to not be coming up in the cell. Then we put in the month as the first 3 letters of the month, and then we put in the year as the last letters of the year and enter. And as we showed you before, that propagates across the thing there. For the time, it's written as it is here. So we're going to be using the 24-hour clock. So 3 o'clock would be 1500. We can see that we've actually got triage date and time and folder date and time. So we're not talking about triage time, and we're not talking about folder time when we talk about arrival time. Some facilities are not recording arrival time. Please do not use proxies. Just put in an X and an X. Now, if you put in an X for arrival date, all the rest of the dates are going to look like X. So you just need to put in the date of the triage, and that will propagate the proper dates across. If you don't have an arrival time recorded, just put an X. And that goes for all the rest of the things as well. If we don't have a triage time recorded, pop in an X. If you leave it blank, we're going to get weird calculations like minus 56,000 minutes to triage time, which really is a pain to try and fix. So triage date should be self-explanatory. Triage time should be noted either on your triage register or in the triage paperwork. The correct paperwork inside you is the provincial triage paperwork that should be being used by each facility now. And it's literally, is it there, is it not? And it's a drop-down box. If it's there, you tick yes. If it's not there, no. Just a note on this, there is triage paperwork for adults that is different from triage paperwork for children. So if it is a child, please make sure that it's the child triage paperwork that is in the patient's folder and vice versa. For the choose documented, there's your drop-down menu and you can put in whatever choose was documented. If it was not documented, put in an X. Let's say that that was a choose of 4. Now this means the person who's doing the audit calculates the choose using the physiological parameters that are actually recorded in the triage paperwork. And so you're going to put down what the choose was that was calculated. And let's say that it was the same. This is already worked out for you, whether the documented and the calculated choose are the same or not. So let's say here that actually the choose was incorrectly calculated, and you'll see immediately it records there that no, it was not the same. Let's keep that as correctly though, because it's always nice to have a nice piece of data. Okay, same thing here. What color was assigned in the notes for the patient? And let's say this patient was assigned a yellow triage category. Now we also need to look at what triage color was calculated is probably a funny word. From looking at the patient's notes and their choose score and their discriminators that are noted, is there anything that actually made a difference here? If the patient still comes out as yellow, you'd mark yellow. If for some reason maybe the patient was orange but is recorded as yellow, then you put that in there, and again that's calculated for you whether the triage color was correct or not. And let's just make that correct because we like correct. Okay, so the date the folder was issued, the time the folder was issued should be on the printout from admin. If it's not, again we just put in an X. The date seen by the healthcare professional. We've had some discussion around this. You can use the time in the notes as a proxy for the date and time seen by the healthcare professional. When we talk healthcare professional, we are not talking the person who did the triage. We're talking about the formal assessment that's done on the patient. However, we're talking about the first assessment beyond triage. So if a patient, for example, comes in with asthma, and it's run past the doctor and the doctor says, put on a nebulizer, that is the time that we can actually start recording having been seen by the healthcare professional. Again, the date and time referred is often difficult, and we don't necessarily want you having to rush off to referral registers and that sort of thing. What we're looking for here is the time that it was written in the patient's notes, the decision to refer. So we're looking for the notation as part of the plan to refer and the time that that was noted. If there's no time noted, please put an X. If there's no plan noted to admit, but the patient was admitted, then we're happy for you to put the last time that the emergency center doctor or CNP wrote notes as the time that the patient was referred. For disposal, you've got various choices. You've got whether the patient was admitted, whether they were admitted to the emergency center observation ward, whether they were transferred, discharged, or whether they died. The date and time left the emergency center. Now again, it's often difficult to get that time from folders. So what we suggest is the first time that the nurse in the ward makes their admission notes. And so that's your data entry.